Fine, which is one of the nursing units off the ground floor. When you wake up, you'll have the catheter, okay? And I'm going to tell you, if you've never had a catheter before, it's going to give you the sensation that you've got to go to the bathroom. It's okay. Just let it happen. You're not going to wet yourself, honestly. You're going to have the drain. If you're asleep, it's on the right. If you're bypass, it's on the left, okay? You're going to get the pain pump, the happy button that you will help self-control your pain. The bottom line is that in recovery room, they will medicate you for your pain. They will medicate you for nausea, okay? I want you to be sure to remember, if you're nauseated, let your nurse know. We don't want you sitting there suffering and heaving. We want you to tell us that you need it, okay? Because it's not routinely ordered, it's ordered on an as-needed basis, okay? If you have sleep apnea, you will not be using your CPAP machine in the hospital, and you will not use it for 6 weeks after when you go home. Those heparin injections I talked about, see, there you go, and you get them 3 times a day until you're discharged. You're going to walk about 2 to 3 hours after you get to the floor, okay? 2 to 3 hours you'll be up and walking. You're going to walk 4 to 5 times a day. You're going to wear those inflatable compression devices while you're in the bed, okay? You may experience gas, nausea, or slight abdominal discomfort. I can tell you the drain pulls and will grab and kind of pinches, and you might get some pain up into your chest and into your shoulder. Getting up and moving is what's going to help you guys progress. The gas, you know, everybody says, when am I going to pass gas? Get up and move. The more you get up and the more you walk, you're going to pass the gas. Nothing to drink the day of surgery. So if you come back from surgery at 3 o'clock in the afternoon and a friend of yours walks in to see you, you say, oh, I'm so thirsty. And they'll say, oh, let me get you some water and some ice chips. No, you can't have it. No water, no ice chips. Nothing until either if you're asleep and you go upstairs to x-ray for an upper GI, or if you're bypassed and they talk to Dr. Yadegar, nothing happens until he gives the okay to move forward with starting you on your liquids. We'll give you stuff to swab your mouth out with. We'll give you mouthwash to rinse your mouth, but nothing. Chapstick, too. So the hospital, the day after surgery, I call it post-op day 1, okay? Dr. Yadegar will speak to your nurse. I will speak to your nurse. I will see you in the morning. If you're doing well, you're going to get started on 15 cc's, which is a half an ounce of alternating water. 15 minutes later, you're going to have protein, okay? You're going to get a sheet, and you're going to keep track. Did I have water? Did I have protein? This little sheet is slotted every 15 minutes. You can determine what you've done. This is the day that your pain pump goes away, okay? And your catheter comes out. So we've taken away what's going to make your pain better, and now we've taken away your route to the bathroom. So guess what? Remember we want you to get up and walk? Now you have to get up and walk because you've got to go to the bathroom. You're going to continue using the incentive spirometer. That's what this is called, is an incentive spirometer. You're going to use this every hour, 10 times every hour. Remember, if you've got the TV on, do it 2 or 3 times every time a commercial comes on, and it'll be helpful for you. Okay? You're going to increase your walking. The night before, the day before, you may get up and you may walk to the door outside your room and say, I'm done, and go back to bed. However, this day, you will be up, you will be walking, you'll be sitting in a chair, you'll be walking, maybe in the bed a little bit. And I'm going to tell you, you're going to be better off sitting in a chair sipping on your liquid as opposed to laying reclined in the bed sipping on your liquid, okay? The drain, it will have a bloody discharge. And it looks almost like a grenade, and what they do is they compress it and they put some vacuum on it to help any fluid that's in your abdominal cavity just come out, as opposed to just sitting there. Because sometimes you ooze a little bit of blood. You know, we want you to be comfortable. We also want to watch, are you having too much fluid? Because you asked about that, the whole leak thing. So we'll be able to see if all of a sudden we start getting mass amounts of fluid out, okay? Lap band patients, this is the time Dr. Yadegar will determine if we're going to go home. Post-op day 2. Guess what? This little cup, you now get to drink the whole thing. It's gone from just going to a little party to Thanksgiving, okay? This here, your incentive spirometer, you're going to continue to use it. You're going to use this for a week after you go home, by the way. Okay? If you're progressing well, the IV and the drain will come out this day. The drain will come out usually in the morning after they talk to Dr. Yadegar. The IV will stay in till just before you go home, because you've had bariatric surgery. You cannot get in more than an ounce, maybe 4 ounces in an hour if you're doing really well. So we want you super hydrated. The #1 cause of readmission to the hospital after a bariatric surgical procedure is, guess what? Dehydration. If you have a bowel movement, it might be somewhat bloody. A lot of patients that have a bowel movement while they're in the hospital, they're so loose. Well, yeah, all you really have is fluid going through there, and you've got some blood in your GI tract, and that's an irritant also. This is when Dr. Yadegar will visit you. I will spend about 45 minutes to an hour with you going over all your discharge information, everything you need to know the first 2 weeks and into your 3rd and 4th week. Okay? I give you Dr. Yadegar's cell phone number. I give you his office phone number. I make sure that you have a way to get in touch with him. Must be discharged to a friend or family member. We are not going to put you in a taxi cab and send you home for someone to meet you at the curb. How do we really know someone's meeting you at the curb? That is not a safe discharge. Our goal is to bring you into surgery safely and make sure you get home safely with someone to take you home. Okay? If you live a long distance from the hospital like you do, you're going to have to stop on your way home about every 30 minutes to get out, stretch, walk around the car. You'll be given a prescription for Tylenol with codeine. It'll be in liquid form. And you will get a prescription for Prilosec. Prilosec is a medication that we have you open up, take the contents of the capsule every day for 90 days. Okay? It's to prevent ulcers. You're going to increase your water and your protein. When you go home, you're no longer going to have to measure it, but you're going to drink very similar to this. A little bit. You don't want this. Because it will hurt. What's that?
Drinking a lot, like you did, it hurts anyway.
It hurts. Even far out like I did this, it cramps a little bit.
It still hurts.
But sip. It's going to be constant sip. Popsicles, the Jello, the broth, all of that stuff. And you're going to try to get at least 6 ounces of water, an hour, which isn't a lot to ask, really. You're not going to lift more than 20 pounds. You're going to be able to take a shower, but you're not going to be able to sit in the bathtub. No bathtub, pool, or jacuzzi until we see you in the office, because we want to make sure that all these incisions that you have on your tummy are dry. Okay? And you're going to walk. You're going to have those 5 wounds. Okay? You're going to keep them clean and dry. The left lower or the right lower may ooze a little bit. For a few days, you're going to send home with some dry dressing and some tape. You'll just put that dressing over that. Usually it scabs up in a couple days. Okay? If you have drainage and it becomes foul smelling, or it changes color or amount, you're going to need to call Dr. Yadegar. If you run a fever, you're going to need to call Dr. Yadegar. No straws, carbonation, caffeine, sugars, or alcohol. All right? No intercourse or oral sex for 2 weeks. You swallow air and too much jostling. You can drive a short distance after a week. No long distance driving for 6 weeks. I'm going to tell you, you'll put that weight on, but that weight will come off. By the time you see us post-op in the office, you'll have lost, say you put on 20 pounds of fluid in the hospital, you'll have lost between 10, 15, 20 pounds by the time you see us. Everybody's a little different. Your post-op visitor with Dr. Yadegar will be with Dr. Yadegar and myself in about 2 weeks after surgery. It's just to see how you're doing, a weight check, see how you're tolerating your protein, how you're starting to adjust, the exercise, what are you doing, all that stuff. And some people, this is where they're ready to say, I need to go back to work. Your target weight loss is 0.3 to 1 pound per day. Okay? When have you ever lost 0.3 to 1 pound a day? No non-steroidals. You're going to use Tylenol or discuss alternative means to deal with your joint issues with your primary care doctor. No pregnancy for 12 to 18 months, because we want you to maximize your weight loss. Okay? No smoking. Smoking will cause nasty ulcers. Again, even the pinch between your cheek and gum, that still counts as nicotine. Basically, your follow-up for long-term to be successful, so you're going to follow up with Dr. Yadegar at 3 to 4 months, 7 to 8 months, 12 months, and yearly after that, okay? Lab results for each visitor are due in the office 1 week before appointment. The other thing that happens is if you come for that appointment and your lab results aren't back, we're looking at your lab results as part of your visit, a big part of your visit, to make sure that, you know, you're getting all the appropriate vitamins and nutrients and minerals and stuff. You're really wasting your appointment. But long-term studies have proved that people who follow up with their surgeon are more successful. For daily exercise, about 60 minutes. Include different exercises, stairs, walking, breaks, dancing, gardening. There's numerous exercises that you can do. And as the weight comes off, you'll notice that your joints feel better. Attend support group. Attention to compliance with diet, exercise, and supplements. I can tell you I've had a couple patients coming to see me at the office, and they're struggling with their weight. So you know what the first thing, any of you guys that have gone through Kaiser know that you have to keep food diaries, right? The first thing I'm going to tell you, where's your food diary? Where's your food log? You know what? I'm 8.5 years out. I keep a food diary. I write down everything I do. I write down every exercise that I do. I write down the amount of water that I take in. Sounds obsessive, but you know what? It's kept me successful. So where I was going, I told this lady, you're not eating enough. And she's bringing me, I had this and I had that. I'm thinking, why are you having a blueberry muffin and a cup of coffee for breakfast? So I said, this is what I want you to do. And I told her exactly what I wanted her to do. She'd been coming to me for 3 weeks and really wasn't making any progress. I said, look, I really need this to happen. She came to me with her food diary. Guess what? She lost 3.1 pounds from last week to this week because she added a little bit more food and she was aware of what she was eating. You know, how often do you think, oh, that looks like that, and you put it on your plate, and it's probably double what you really should be having, okay? You should really, really, when you're starting with your food, is start measuring it. Be aware of it. Don't get comfortable. Once you get comfortable, that's what gets you in trouble. Chewable, powder, or liquid multivitamin. You're going to do 1 chewable twice a day, okay? You're going to do B12, 1,000 micrograms. Sublingual, once a week under your tongue. If you do it orally, just take the pill, you're going to have to take it daily. If you go and get an injection, and go to your doctor, it's usually once a month, okay? Calcium. Calcium citrate, not calcium carbonate. Biotin, you're going to do 1 to 5 milligrams of biotin daily. You're going to continue with your Prilosec for 90 days after surgery, okay? And women who are menstruating eat foods high in iron, spinach, broccoli, beans, fish, poultry, whole grains. The first 2 weeks, so with a Roux and Y, you'll get 1 to 2 ounces in, which is about equal to 2 to 4 tablespoons. With the sleeve, it's 2 to 3 ounces, which is 4 to 6 tablespoons. And the band, 2 ounces is about 4 tablespoons. So basically, you're going to be having water, protein, your sugar-free Jell-O, sugar-free popsicles. And I'll tell you guys, most patients tell me this is their lifesaver right here, is their sugar-free popsicles. The broth, fat-free milk. If you can't drink milk, you can try soy milk or almond milk. And sugar-free, low-fat, well, it's actually low-fat blended yogurt. Okay, the yogurt that has no chunks. In the 3rd and 4th week, this is actually where you get to really start trying food. You'll get to start with some cottage cheese, low-fat cheese, maybe some string cheese, scrambled or poached eggs. When we talk about a scrambled egg, you know how when you scramble it, it's kind of moist and it's cooked, and then it's soft, and then it becomes dry? You don't want that. You want it moist. You don't want the dry. Because if you have it dry, it will feel like it's dragging all the way down. Okay. Poached eggs. Some people have issues with poached eggs because they need toast to wipe up the yolky goodness like me. So, or steamed or poached fish or shrimp. This is where you'll be able to try some tuna fish, maybe some grilled tilapia. You're going to stay away from the firmer type fish, you know, like salmon and halibut and mahi, that kind of stuff. All right, and your protein drink. Weeks 5 and 6, okay? You're going to transition from that soft, textured food. You're going to be trying more moist, solid foods, okay? Go slow. The bottom line is put your fork down between your bites. Chew your food. Enjoy your food. Taste your food. Just don't swallow your food, okay? Because I guarantee you something will get stuck. If one food disagrees with you, try it again another time. And it says right there, it's trial and error, you know. It may work. It may work one day, but it may not work the next day. So that's why you have to kind of trial and error it, okay? No red meat for 3 months. No salad or raw vegetables for 6 weeks. Okay? At least 8-ounce glasses of water a day. That's 64 ounces, okay? And remember, you're not going to eat and drink together, okay? They're going to be completely separate. Nothing for 15 minutes before, nothing during your meal, and nothing for 30 minutes after. Nutrition for life. This is the weight loss pyramid. So basically, the bottom of the pyramid, which is basically the structure, it's low-fat, lean protein, okay? You're going to have milk, cheese, yogurt, fish, poultry, eggs, beans, tofu, pork, tenderloin, and legumes. Non-starchy fruits and vegetables would be next. You know what? You don't want corn and peas in the same meal because it's all just a starchy vegetable. So you want non-starchy fruits and vegetables. Broccoli, cauliflower, mushrooms, melons, apples, plums, peaches, berries, kiwis, okay? And then whole grains, barley, brown rice. You're going to want to kind of switch away from the gummy white rice, the gummy white bread, and you're going to want to go with, you know, more of a whole grain type bread. If you're going to go out to eat somewhere, and they say it comes with some kind of garlic aioli sauce or something, ask for your sauce on the side. You make the decision on how you're going to eat, okay? On the side. It's all doable, okay? And you will be able to go out to eat again. You will eat real food again. You never have to worry that I'm never ever going to have food again. That's called the last meal phenomenon, and a lot of people just go, I'm never going to eat again. I have to go out and I have to have this, I have to have this. You guys are going to be able to eat again. It's just not going to be the quantity that you've been used to eating, okay? It occurs when food passes too quickly into the, from the stomach into the intestine. So what that means is usually caused by sugars or carbohydrates, excess fat intake, overeating, or eating too quickly, or drinking with your meals. It results in heart palpitations, nausea, cramping tummy, abdominal pain, diarrhea. So lactose intolerance, especially with people who've had a room-wide gastric bypass. If you're lactose intolerant before, frequently you're not lactose intolerant after. Okay? But you may be sensitive to the product. And it includes, look at that, cramping, bloating, diarrhea, gas, nausea. Surprise, it almost looks like dumping. Avoid cow's milk if the symptoms persist. Try soy, lactose-reduced milk, some almond milk. You can usually still tolerate the cottage cheese and yogurt and cheese. Alcohol, okay? No alcohol for 3 months after surgery. It resumed, limit your intake to about 4 ounces, and we're not doing beer. Try a small amount at home because you don't want to go out in public with it the first couple times you drink because it hits you pretty quickly. It leaves you pretty quickly, but your blood alcohol level still does stay high. Take ownership of your tool. The surgery you're getting is a tool. And I tell people, you know what? The surgery is really the easy part. The hard part comes after, when you have to have that compliance. You've got yourself, you've got the accountability to yourself, own it. You know what? Your family can support you, your friends can support you, but you're the one to make the ultimate decision.